Welcome to A Closer Look. Today we're going to be talking about something that a lot of people do but may not want to admit that they do, snoring. Joining me is Dr. Richard Debo with Eastern Virginia Ear, Nose, and Throat Specialist. Thank you for joining me today.
Thank you for having me.
So we talk about snoring. Snoring can sometimes be a very serious medical condition.
Yeah, snoring, usually snoring is the earliest signs of a medical condition called obstructive sleep apnea. And what's happening with obstructive sleep apnea is as a patient becomes progressively more relaxed, their soft tissues in the back of the throat will tend to collapse backwards. As it narrows, it narrows the airway and creates some turbulence, which then we hear as snoring. But when they get so relaxed that it completely blocks the airway, then if somebody's watching you sleep, they'll actually see you struggling, where you'll be trying to move air, but you won't be able to. And then eventually they'll hear this loud gasp, and then you go right back to the snoring again. Very disturbing for the person that's observing you, okay? If you've ever seen somebody choking, that's a lot of what it looks like. It also physiologically does a lot of things to the body. So it raises the blood pressure, can give you heart problems, can disturb your sleep so that your thought processes may not be good during the daytime, and you may feel a lot of excessive fatigue throughout the day and fall asleep inappropriately. The standard treatments for it are less than perfect, okay? So there are things like, weight loss for people that are excessively heavy, which can contribute to the development of sleep apnea. There's some dental devices that people will use, and that helps to move the soft tissues out of the way. And what I get involved with mostly are surgical management options, which can range anywhere from removing somebody's tonsils to shifting their facial skeleton around in order to open the airway. Most of the people, when you start telling them that you're gonna adjust their mandible and that, they look at you and they go, "For snoring?"
Which you wouldn't, exactly,
yeah.
because you wouldn't think that all those things could contribute to snoring.
Exactly, and what they've found over time is that usually it's a multiple different areas of your airway are being affected by that. The gold standard for therapy is something called CPAP, or continuous positive airway pressure, where basically you wear a machine at night that you strap onto your face, and when it senses that you're taking a breath in, it sort of puffs extra air in to get past the obstructed area. That's the current gold standard, but a lot of people don't like it. And long term, they may feel good when they first try it, but a year out, most people don't want to wear it, and so they're not taking it with them. They're not wearing it long enough for it really to give them the health benefits that they need.
Because it's quite large. I've seen them. That it's a lot to it, actually.
Yeah, when you travel, you need to. It's like carrying an extra suitcase with you. They've come down in size, but still a lot of people don't care for them. There's a lot of maintenance. You have to keep them clean and things along those lines. There's a new treatment that's available now, something called Inspire therapy, which is what we've started doing. I have a partner, Dr. Kimberly Pasquale, and myself, and we are using an implant similar to a cardiac pacemaker, but it's a pacemaker for your respiration. And what the Inspire implant is, what the device is we use an outpatient surgical procedure in order to put it in. We put a little sensor next to the muscles in the ribs, okay, which senses when you're trying to take a breath in. It sends a signal to the pacemaker box, which then sends a signal to a small nerve under your chin, which controls the motion of the tongue. And what that electrode does is it activates the nerve branches that pull the tongue out of the way when you're trying to take a breath in. So it's a very elegant solution
Fascinating.
that that works the way it's the way your body is supposed to be working to open your airway at the time that you need it open.
So who is a good candidate to get the Inspire device?
So you have to have adequate amounts of sleep apnea. So we're using this for moderate to severe obstructive sleep apneics. You can't be too heavy. So we want the BMI, which is a measure of how big you are, to be 35 or less. You have to have on your sleep study, okay, you have to have an apnea-hypopnea index. That means the amount of times that you stop breathing has to be between 15 and 65. And you have to have failed CPAP, because if you can tolerate the CPAP, if that's working well for
Right.
you, then you don't need a surgery, okay, even though it's an outpatient surgery and that. But the nice thing about this is you're not having to lug around a machine with you when you go on trips and stuff like that. You actually, in order to activate it, you have something about the size of a TV remote.
That's what I was going to ask you.
Yeah.
How is it something that automatically is activated, or do you have to physically activate it when you go to bed?
So what you do, well, let me back up a little
Okay.
bit and talk a little bit more about the surgery. So basically, we do the surgery as an outpatient procedure, and once we've got it all placed, then we test it out, make sure that everything is going to work the way we want it to work, and then we turn it off. And we leave it off for a month until all of this heals, and then you come into your sleep doctor's office and they will activate it for you. So what they do is they give you this TV remote, okay, which you place over your pacemaker, you turn it on, okay, and they'll have a variety of different settings. So you can start it off with a very low stimulus, and over time increase the intensity of it in order to get the amount of opening that we need to to widen your airway. But it also, we don't want it to hurt. So you can adjust it for comfort level too. And they set it so that it usually will start about 30 minutes after you go to sleep, so that you get a chance to fall asleep normally, but about the time that you're going to start snoring
Right.
and stopping breathing, it kicks in, and so it opens your airway for you all night long.
So the procedure, do you do this at Chesapeake Regional Healthcare?
Yes, so that's
Okay.
the only place that we're doing it at this point in time. We're looking into some other options and that, but currently Chesapeake is the only place that it's available.
So and we can find out more information if they go to chesapeakeregional.com/inspire.
Yes.
And they can find out if they qualify or just want to get more information
Yes.
about that.
Yeah. Yes, and calling that number oftentimes will put them in contact with somebody that is aware that they're going to is aware that they're looking for information about the Inspire, and that we handle those patients a little differently.
All right.
So
Well, thank you so much, Dr. Debo, for talking about Inspire. It sounds like it's going to change a lot of people's lives.
I think it's going to be a big game changer. So
Oh, absolutely.
Yeah.
Thank you so much.
You're
Appreciate
welcome.
it.
Thank you.
Well, that does it for this episode of A Closer Look. Be sure to watch us next time.